Hi, I'm Alex Richards. I work for the Chicago Tribune. Several years ago, I worked at a paper in Las Vegas called The Sun. We did a very large five-part series using hospital billing data to track how well hospitals were reporting significant harm and significant errors in patient harm. So we were able to submit a request to the state of Nevada and we ultimately received roughly 3 million records for every case of every inpatient case, anybody who had had a stay at a hospital. It essentially said, some vital statistics about them, how old they were, the different conditions that they came in with, what was done to them, and then there was a bunch of charge information, like how much things cost. And so one thing we were able to track, linking onto these different codes in the data set, is we were able to see sort of see different errors, like people getting a surgical instrument left inside of them, people getting an infection from a catheter. We narrowed it down to a list of roughly 10 things that the government, through Medicare and Medicaid, no longer pays for. And those were what we found. We found several thousand instances of this happening when the hospitals were actually only reporting a few dozen to the state. It was a huge mismatch, and it ultimately resulted in several new transparency laws in the state of Nevada.
What was your role in the project?
I was the primary data person in the project. I was the one who negotiated with the state for the records, especially with the vendor that held all the records. I was the one doing the analysis, finding errors in the data, and then going back to the vendor that kept the records. The administrative data that we got was surprisingly dirty. There were a lot of issues with it, a lot of things needed to be fixed. We identified a lot of problems with it that would have prevented the analysis. So I was taking the data, these large tables that were broken up into years. I was importing them into a open source database manager, MySQL, and doing a lot of the analysis there. We also got downloaded software from the federal government that helped us risk adjust certain cases, because certain hospitals would have older, sicker patients, to see like how far above a national baseline they were for different types of harm.